for years. My wife was German. They spend a lot of money on preventative health programs. And even Kaiser, which I think is a model organization, and we both belong to Kaiser, they do a lot in preventative medicine. They have weight classes, all sorts of things to try and keep you healthy. But they don't have a profit motive. They're a nonprofit corporation. Getting back to that, I think a nation's health is a critical element in the value of the nation and to the citizens that belong to it. I think it is a basic human right, not a privilege. We have a system that's based strictly upon, can you pay for it? If you can't, people criticized Obama stupidly because they were going to have what they called, death panels? Well, they had death panels now. They're insurance companies. They decide what care you're going to get. I've been lucky. I've never been in the hospital, except for one very small accident on my bicycle. So I belong to Kaiser, but I've never really used it. But I've had enough experience with it and other people to say that it is a better type of health system. And basically Kaiser is a single payer type system.
What can we do about it? Is there some way we can piece it back together, particular strategy?
I started doing volunteer things with nonprofits. I thought we could change society or make society a better place to live. And but I was brought up that way. My family felt, there's a social contract, you're responsible, you need to get out there and do things. We were not a passive family in any sense of the word. I want to believe that America can change. That what I think are the strong points of our society can be reinforced. That we will get to a point where we feel we have a commitment to one another. But I don't see an effective channel to achieve that. I see very little difference between the Republican and Democratic parties. And Congress, both the House and the Senate, are basically clubs for very, very well. The vast majority of senators are millionaires. And I think half of Congress falls into that classification. But I also know this, because my hobby is history. I done a lot of reading in history and what motivates people. No government can sustain itself when the majority of its population becomes dissatisfied. We're going to reach a tipping point.
Perhaps we have.
In some areas we have. I think we're going to reach a tipping point as far as healthcare is concerned very, very quickly at this point. We now have, 44 million people who are uninsured, whose only avenue is to go to a hospital and ask for charity in the emergency unit. So I think on healthcare we'll reach a point where it'll become a national demand to change. We may get to a point where there's a national demand, but I think it's less likely to do a better job on education. Rarely did their education, even the best of education, their knowledge of recent and current economic and political history is abysmal because it isn't taught. I think about the most effective thing that individuals can do, short of forming movements, and movements do work. I don't have any question about it. All you have to do is go back to Martin Luther King and the Civil Rights Movement.
Or the union movement.
Union movement prior to that. They galvanized people. They drove the political process. The political process did not anticipate, they reacted to the pressure that was brought upon them. The March on Washington, the actions of the Freedom Riders forced Congress to act. They didn't act out of conscience, they acted out of necessity. I was hoping there would be movement in the financial sector because of the criminality that took place.
But they co-opted the legislative process.
They co-opted it, so nothing occurred. And those truly responsible paid no penalties whatsoever. But I was hoping, at least they would go back and reenact the Glass-Steagall Act that our very progressive President Clinton signed out of existence. I think there is things individuals can do, and it basically revolves around volunteering to help nonprofits succeed. I don't like the term. When I deal with my clients, I do pro bono consulting. I did that with the mission.
The Executive Service Corps.
Yeah, there's their data, which is an organization that's been around for about 28 years. Right now it has about 150 retired and semi-retired executive level people.
Just here in Southern California.
Just here in Los Angeles.
They're elsewhere though as well.
Yes, they're in San Francisco, Seattle, New York, a couple other cities I can't recall.
But they're not even close to everywhere.
No.
Okay.
Not even close. Maybe I think we're in 12 cities. And I do some contract consulting work also. I think by volunteering to work in these organizations, other than Executive Service Corps, because it's an organized way of doing it, that if people can share the values of the organization and believe in its cause and look at them as movements, they can move these organizations forward. And most of the nonprofits really will reestablish a social contract. Most of them are in areas that are there to improve the quality of life of society as a whole.
Especially at the low end.
At the low end and even sometimes in the middle end. If you look at the Sierra Club, it's basically working to produce more and more national parks and protective areas. Turns out that poor people don't go to national parks. The middle class goes to national parks. But you're right, most of them do provide services for those who will not receive them because of their economic position. But not in all cases. I'm doing work right now with an organization called No Limits, which teaches deaf children to speak. Well, this little organization takes deaf children 3 years onward, and through theater programs and individual tutoring, teaches them how to speak. Now, all of the children they teach either use hearing aids or cochlear implants. But that's what they do. So they're trying to bridge the gap of an unmet need. In fact, most good nonprofits, really that's what they do. They're meeting an unmet need, a need that isn't being met through government
or industry.
So for No Limits, the need was, there were no schools or programs available to teach hearing impaired children how to speak. LA Mission, as an example, unmet need. What do you do with homeless people? Especially what do you do with homeless people who have mental illness? And here's a good case of the break in the social contract. Prior to 1960, whenever Reagan was governor of California, closed all the mental hospitals.
About 2/3 of them.
A lot of them.
With the stroke of a pen.
Stroke of a pen. With the quote-unquote premise that the counties would take over this, or the city. Someone else would do it. Well, no one else did it.
So the people ended up on the street?
Right. About 80% of the persistent homeless have some degree of mental illness. Homelessness is a symptom of the disease that they have. If they're alcohol and drug addicted, there is, in most cases, a psychological basis for the addictive behavior that to some degree may or may not be treatable. So the LA Mission got into business to meet that unmet need. They started doing alcohol and drug rehabilitation programs. And then as the economy changed and you got more and more middle class people suddenly being thrown into poverty, and they've seen a significant increase in the number of families that they deal with and the number of women with children, differently than women and children they saw in the past. These, and I call them social enterprise corporations rather than nonprofit, because that's really what they are. They're social enterprise corporations. And if you read the California law that grants a license to a nonprofit, it reads, a license is being issued to a social enterprise corporation to meet an unmet public need. Some words to that effect. I don't like to, when I talk to a potential donor or contributor, I don't want to start off saying I'm a nonprofit. That's not the reason these organizations are in existence. They happen to get a nonprofit status because of what they do, but it tends to give the impression that they're there because we don't pay taxes. It's not the reason. The reason is we're meeting an unmet social need. So I think if more and more people, and it's very difficult getting people to volunteer.
Why?
Very, very difficult. I'm going to write a paper on that one day. Why? You know, it varies across demographic sectors.
I have a better question.
Sure.
You answer that one, but I have a better question. What can we do about it?
We've had lots of discussions, myself and a close circle of friends who work in the nonprofit sector. It varies. It's relatively easy to get women to volunteer. It's somewhat harder to get white men to volunteer. Very difficult to get Latino and black men to volunteer. And in some cases, it's almost impossible to get black men to volunteer, even to support black-orientated organizations. And I don't know all the reasons behind it, but it's a real issue. What was your question again? I guess I wandered off.
What can we do to increase volunteerism?
Well, I think we need to understand why people volunteer. I think you'll find two groups. You'll find a group of people volunteering because they receive or have received a benefit from the organization.
Okay.
A good example might be Children's Hospital. Children's Hospital has a large volunteer corps.
Most of them are relatives of someone who was treated.
Relatives, or they had a daughter or a son or someone that went through the hospital and received a benefit from it. People volunteer at churches because they receive a benefit from being a member. People volunteer for things like charter schools because it's an inducement to get the school to accept their child or in partial payment. The other group of people, and those are the ones I really would like to target, are people that believe in a cause. If you're a social enterprise corporation or nonprofit, and you don't have a clearly defined set of values, cause that reflects those values, you don't deserve to be in business. You're in business probably to make money, and there are a lot of those, unfortunately. But if you can get people to buy into the values of an organization and to believe in its cause, we can get those people to volunteer.
And we could raise money more easily that way too.
You'd raise money, you'd raise awareness, you get more networking, etc. But what's interesting, after working with nonprofits for the past 10 years, and I was an officer on 2 nonprofit boards, 2 organizations that did microeconomic lending, Tanzania, Kenya, and Uganda. And there it was relatively easy to get volunteers and board members because there's a high degree of romance in saving Africa. And I came to the conclusion a lot of issues here in the States are more important. Maybe, they're important there, but this is where I live. What's interesting is that most nonprofits do a lousy job in explaining their values and the cause that they support. There is an assumption that because an organization does good work and services the community will automatically know what they do and value. With the exception of some very large national organizations, Red Cross, United Way, the Breast Cancer Group, etc. Most nonprofits work in a environment where they're basically anonymous, other than the small group of people that they serve. Nonprofits have difficulty in getting people to volunteer because they do a poor job in communicating their values, their cause, and getting people to join a movement. I also believe that once a population or a group really understands what the cause is all about, that you'll get volunteers to join it.
And you'll get money.
You'll get money too. My contention is get the volunteers first, the money comes afterwards. What you want to do, and what we talk about when we talk about development in nonprofits, you want to get donors.